Health with Mariposa.
Muy buenas noches, Nogales. Bienvenido a la primera producción de Talk Health con Mariposa. Again, welcome, Nogales. It's our first production of Talk Health with Mariposa Community Health Center. My name is Eladio Pereira. I'm the Chief Medical Officer at the clinic. And we have two distinguished guests to talk about pediatric issues. Mi nombre es Eladio Pereira. Tengo dos compañeros de trabajo en el departamento de pediatría, el doctor Phil Williams y la doctora Tanya Henry. Le damos la bienvenida a los dos. Muchas gracias por acompañarnos esta noche. Vamos a hablar mucho de pediatría. Va a ser una conversación muy interesante, and we hope it's beneficial for our audience. So welcome, Dr. Williams and Dr. Henry.
Thank you.
That's great.
Gracias para invitarnos.
I also want to thank We Love Nogales for their support in making this a reality. We have a number of issues to discuss with our guests. We hope that it's beneficial to all of you. We hope to talk about things that are really common and make a big difference in the lives of our patients. So let's get started, right? So when we actually prepare for this, I actually met with Dr. Henry. I said, Dr. Henry, I want you to talk about a couple of things that you want to tell folks about good pediatric care. What would you like to share with our parents about good recommendations for them? And I realize there are a lot of them. I get that, but choose 3 or 4 that are in your mind that every day you think, I wish parents would do this. And so let's start right there. So we start with Dr. Williams first.
Sounds good. Thank you so much for having us. And the number one thing that I like to stress is that preventative medicine is the best medicine. So what does that mean? It really means that just coming to the doctor regularly for preventative healthcare visits. So what does that mean? It means that, especially here in the U.S., a lot of times we wait until a person has an advanced disease. We wait till they're 65 and they have advanced diabetes and heart disease. But really, if you would, come to the doctor on a regular basis, eat healthy, there's all these things you can do to prevent yourself from getting all of these long-term illnesses. So one thing that I stress to all my patients is that, make sure that you come in early. Preventive medicine is so important. So what does that mean? It means that for babies, we really see you pretty often. So we see you at birth, we see you again at 1 month, 2 months, 4 months, 6 months, 9 months, 12 months. There's basically every 3 to 4 months, you're going to have a physical. So what do we do in those physicals? We basically are making sure that you are, 1, growing okay, so making sure their height and weight are both appropriate, and also making sure that you're developing okay. In addition to making sure that you have a normal physical exam, you don't have pneumonia or meningitis or something else really worrisome. Those by far are the rarities. The main thing is just making sure that you're developing well.
So let's expand on that, and then we'll go back to Dr. Henry just a moment. So what are things that you look for when you see a newborn or a 1-month-old? What attracts your attention right away? And what should parents know about perhaps some symptoms or signs that you look for? You see them in the office and you ask them questions. What creates an awareness really important? Let's
That's a good question. So first thing we want to make sure is that they're growing well. Okay. So the first thing I always look at is their height and their weight. So for instance, if babies are really sick, if they have a chronic illness, if they have something, they're not going to grow. They're not going to grow well as a general rule. So first thing I want to make sure is that they're gaining weight okay, and there's actually an equation that we use to make sure they're gaining a certain amount within the first few weeks of life, and also that their height and weight are both appropriate. So for instance, if a baby is really, really long, but they're under the growth chart, that could be abnormal. Or if the opposite, if they're really, really overweight and that they're very, 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 very small, that can also be an issue. Okay. So just by simply looking at the numbers is one thing. The second thing I do is, as soon as I walk in a room, I just literally look at the baby. In our training, we're trained to develop sick from non-sick. So literally just by taking 5-10 second glance at a baby, you can tell if they fall into either one of those categories.
Okay.
And thank God, most of our babies are in the non-sick category. So after just taking a look at them, then I talk to parents. Especially for newborns, seeing how well the parents are doing is vitally, vitally important. Okay. And you can a lot of times tell. You know, I have 3 kids, so I know how it is. But especially as a new parent, you know, you can have your baby's waking up every hour. You know, you're exhausted. You are breastfeeding, and if you're dad, even you're giving bottles, but you're waking up all the time. So I want to make sure that parents, one, that they look okay. Are you overly stressed? Because if you're overly stressed, that means that the baby's also going to be stressed. So I talk to the parents to make sure that they're doing well. A lot of times they have a whole long list of questions. I always like it when my parents write down the questions, because it's a rule. You know, you go to the doctor, you have all these questions before. As soon as you get there, you forget half of them. Right. So it's always good to have a list. So I want to make sure that their parents are doing well. And the last thing we do is that we actually examine the baby. So we want to examine them head to toe to make sure that they don't have anything abnormal.
Right. It's excellent. All right. Let's have Dr. Henry talk about what are things that come to your mind in terms of general recommendations for good health in the pediatrics age group.
So as Dr. Williams was saying, we're looking at lots of different things. You know, we're looking at your growth, we're looking at development, and then in our clinic here at Mariposa, we have a lot of tools that we use to kind of help look at these in more detail. So for instance, Dr. Williams mentioned the importance of making sure our parents are okay, you know, feeling well emotionally after the birth of their baby. And so we actually will have moms fill out screening forms to look for signs of postpartum depression. And that we like to do because it's a very sensitive way to pick up that information and for us to help our parents that are in need. We also screen for this in a way to normalize it, to let moms know it's okay if you're not feeling super happy after the birth of your baby. That can be normal. It's nothing to be ashamed of, and so it's something we're going to talk about, you know. And so a lot of it is reassurance of parents that how they're feeling is okay. Okay. What they're doing is good. I think that's a big role of the pediatrician, is to really kind of be the coach for the parents, and, you know, we're on your team. We're on your side, and we're also on the side of your child. But our job, especially when they're young, is to kind of help coach you through the problems and coach you through those hard times and give you the tools that you need to kind of really do the best that you can for your child.
Right. So it's about the parents also. It's not just about the child. And it's about sort of a team effort as well. Right? Exactly.
It's always a team, and that never goes away. From the time that you bring in your baby to the time you bring in your 18-year-old, we're all part of a big team for the health of your child.
Thank you very much. So I want to touch a little bit about a common problem that we see is the use of antibiotics. Antibióticos se usan mucho en la medicina, son medicinas que tenemos disponibles para tratar infecciones causadas por bacterias, viruses, hongos, etc. En los últimos años ha habido mucho interés en el uso apropiado de antibióticos. Sabemos que a veces el uso es un poquito excesivo por muchas razones, pero estamos poniendo mucho énfasis en el uso apropiado para evitar resistencia, para evitar que las bacterias se pongan resistentes a los antibióticos, porque cuando las tengamos que usar en el momento apropiado no las vamos a poder usar, ¿no? Y en pediatría es muy importante, recetamos antibióticos por varias razones. Quería hablar un poquito de sus ideas de cómo ha cambiado la medicina en pediatría en el uso apropiado de antibióticos, qué podemos hacer para educar a nuestros pacientes en el uso apropiado. Y más importante, cómo el doctor, qué herramientas tiene el doctor disponibles para decidir qué es una infección viral, qué es una infección bacterial, qué tipo de síndromes requieren el uso antibiótico por unos días en lo que tengamos un resultado apropiado. Dr. Williams, ¿puede hablar un poquito acerca de todo eso?
So before you start talking about antibiotics, I think it's important to talk about the different types of infections, because for a lot of our patients, we really want to educate them on what exactly is going on. Because I know it's hard. I have a kid, and your kid has fever, and the first thing you want to do something, right? But before we start talking about antibiotics, you have to talk about there's basically 3 major types of infections. There are viruses, there's bacteria, and then there are funguses. By far, the most common infection that we see are viruses. There are different studies, but roughly, approximately 90% of the infections that we see are viral. Roughly 10% are bacterial, and really it's pretty rare, but maybe 1% or so are fungal. Okay. So then what does that mean? It means that antibiotics, the current antibiotics, almost all that we use, only specifically work for bacteria, meaning that they only work for roughly 10% of the infections that we see. So what does that mean? It means that if you're in that 90% of patients, antibiotics do not work. Okay. Right? So we only want to give kids and adults medicines that work, right? So if your kid has a virus, antibiotics, they will not work. So why is that important, though? The importance is that bacteria, they're a living, breathing organism, and they are smart. What happens is that bacteria, they can literally mutate, or they can actually change based on the antibiotics that they're exposed to. For instance, there's a common urinary tract infections we see a lot. You see them more in adults, but you also see them in kids. What's happened is that for years, you've come in, you have a little bit of pain when you urinate. You may or may not have a urinary tract infection or not. You give antibiotics. And for the last 50 years, we've been giving antibiotics for urinary tract infections. What's happened is that the bacteria, they've actually mutated, where that the majority of the antibiotics that we've used for urinary tract infections do not work now. Meaning that we only have just a few antibiotics that can actually work. And they're usually stronger antibiotics, and they usually have more side effects than others. So what happens is that you're basically increasing your risk. You have to use these really, really strong medicines. The analogy is that you're going to use a bazooka to kill something very small, right? So we have to use these really big guns instead of using what we want is just a sniper rifle or something that's going to hit right at what we're treating. Okay. We have to use these big things. And as everybody knows, we've all seen Rambo movies. Bazookas, they destroy everything, right? They have a lot of side effects, right? That's not what we want. So it's important to know, again, that the majority of what infections that kids and adults have are simply viral that do not need antibiotics.
Great.
So then what you would ask is, say you have the parents that say, okay, well, my child doesn't need an antibiotic is not going to work, but what do I do? What should I give them?
Yes. Very good question. So it's a good question, and that's where you mentioned the team is important. So one, you have to have trust, right? So if thank God, a lot of my patients have been with me I've been here for almost 10 years. So they've been with me for almost a decade, so I think we have a great trust. I know Dr. Henry's been for 8 years. Yeah. So it's a good question. So first thing is that you really want to identify what do they have. So that's where the physical exam comes in. So for instance, we examine the kids. We sometimes do tests. For instance, if you have strep throat is a throat infection that you can get. It can really, by exam, it can actually look very similar to a virus, but we have a test for it. So we can test them. The kids hate it, but we swab the back of their throat, and if they come out positive for this bacteria called streptococcus, then we do use an antibiotic, and based on their symptoms, we know which antibiotics work. So that is a case where you can. If they're in that 90% where they have a throat infection, but it is it's negative, right? You do throat cultures, you do these rapid strep tests. If everything is negative, then basically it's what we call supportive care, which means that I reassure them that your body is the best medicine that exists, right? So your body will heal whatever is going on. I want close contact with you just in the rare case that your child doesn't get better. So one, I set expectations. I say that the typical course of this illness is probably 3 to 5 days. If after 4 or 5 days, if you're not getting better, if you're getting worse, we need to see you back again because we may need to reevaluate. I also tell them that again, antibiotics isn't indicated in this case, but I want for you to contact me. So I want to know how he's doing. Yeah. And especially for kids that may look a little bit sick or they say you're a little bit young, a lot of times we'll call them. We'll say, hey, I saw you 2 days ago, but I saw your kid had 103 fever. I know you're really worried. We didn't do antibiotics, but how are they doing? And a lot of times they say, he's a little bit better, or they may say he's not any better. In which case I say I want to see you back again. So it's really close contact.
And then I think one thing I would want to really share, and one thing I do share with my parents, as Phil said, the human body is so, so strong. And I just really want to impress on parents that their child's immune system is super strong and it's working very hard to get rid of that infection. And the things that they can do to help support that child's immune system are so basic. Just drinking lots and lots of fluids, lots of water, good old chicken soup, lots of rest. If you need to stay home from school, that's fine. Until you're better, that's fine. If you have a sore throat, making sure the foods you give are soft. Lots of popsicles. Contrary to popular belief, a lot of kids will feel better having a popsicle when they have a sore throat. Sometimes that can help. And it's not going to make them worse. Right. And so I just really like to really get into my supportive care and just let them know that as long as we can support them during this time, that usually the child is going to do very, very well. Right. And I also like to let parents know that antibiotics can cause a lot of diarrhea and kind of sometimes vomiting and just side effects that we don't really want. And so antibiotics are not necessarily always the answer.
Right. So that shows the importance of the practice of medicine. So the practice of medicine involves a good history and a good physical exam, right? So, and in fact, a lot of the medicine we practice depends on that. Most of the diagnoses we make in ambulatory care depend on that. There are some testing we do to diagnose diabetes, and that's fine. But we physicians depend a lot in what the patients and the parents tell us. So, having said that, let's talk a little bit about infections and what makes you think that it's a virus versus a bacteria. So in terms of the site of the infection, whether it's a respiratory tract or whether it's in the ear or the urine, tell us a little bit about things you look for. Say, hey, this is likely viral illness, no additional testing is needed, the treatment is conservative, call us if you get worse and we'll be here to manage that accordingly. So tell us about what you look for in the history, and perhaps subsequent to that, what physical findings sometimes give us an idea of what may be going on with this skin infection and things like that. So it goes back to the art and the science of practicing medicine.
Very, very good question. A couple things. So basically, there's probably 5 or 6 common diagnoses that we see in pediatrics. The first one is just the common cold, or we call it viral or upper respiratory tract infection. So what is that? So that's basically a kid that comes in with runny nose, cough, nasal congestion. They may have fever. It could be high, but it's usually not usually not more than 103, 104, right. Very rarely 105. So they can have, mid to low grade fevers. And that is simply a cold, and almost always is just a virus. So cough, nasal congestion, maybe fever is a cold.
Okay.
Second infection that we commonly see are ear infections. Ear infections are divided into 2 groups, viruses and bacteria. The physical exam is what we use to diagnose an ear infection. So we're looking for so basically a bulging eardrum, something that's red. Basically, you need special tools in order to see them. It's not something that a parent can diagnose. So if your child comes in with fever and ear pain, we want to see them because it definitely could be an ear infection. And a lot of times, based on appearance, those are actually caused by bacteria, and those actually do need antibiotics. The third most common infection that we see are throat infections. So we kind of mentioned 90% are viral, 10% are bacterial, but we have testing for that. A lot of times it's very hard for us to say just by looking. There are some findings. So both can have redness, both can have white dots or pus in the back of their throat. Red little dots on the roof of your mouth are actually more specific for bacteria. It's called palatal petechiae. It's a medical term that we use, but those red dots can actually be more specific for bacteria than a virus. But even still, you could have both symptoms, which is why there's testing, and we can do a rapid test in the office. We'll have the results back in 5 minutes. It's not 100%. It's I think the sensitivity is in the 80-something percent. So there's still a 15% chance it could be a bacteria, but a lot of times we send out throat cultures, which are really, really pretty specific or really pretty accurate, in which case if those come out positive for bacteria, then that is a bacteria we can go ahead and treat. The fourth most common illness that we see are what we call gastroenteritis, so vomiting and diarrhea. Those honestly are usually viral. So a kid comes up, they're vomiting, they're having diarrhea. It's very rare that it's caused by a bacteria. It could be signs that could lead more to bacteria. If you're having a lot of bloody diarrhea, that could be, that a lot of times is bacterial, but it's not 100%. We also see parasites here. We said that there's 3 common types of diseases, but parasites are one that we also see here commonly on the border from contaminated water. You drink from a stream, you travel to another country, it's also common. So those are the kind of the major illnesses that we see. The last one is urinary tract infection. Urinary tract infections are also usually bacterial, but again, we send those out for culture. So we do tests in the office. We can actually see a rapid test again that can tell us maybe this is a bacteria, but then we also send it for a culture, get the results back in 2 days, which can say this is a bacteria.
Yeah. And then I would just add, when families come to the doctor and they're wondering, what does my child have? What exactly is going on? The biggest thing that we do is just those questions that we ask you in the first several minutes of the encounter. Those are the biggest opportunities that we have to figure out and diagnose your child. And so knowing that you are the expert on your child and you're telling us everything you've observed about your child, and then also when we speak to your child and your child tells us how they're feeling, 90% of the time before we even touch your child, we're going to know what's going on. And so history is so important. So if we're asking you a million questions, please don't get upset. We really want to know and understand kind of how you feel things have been going so we can get the best picture and have the highest chance of really diagnosing your child. That being said, once we move on to the physical exam, it is so important. So I know that there can be some frustration sometimes when you feel that, you haven't gotten any medicines, you haven't gotten antibiotics, but my child is sick. But one of the biggest things that I love about pediatrics and medicine is that just by doing a history and a really good physical exam, really good physical exam is better than a world of unnecessary blood tests. And so that's super important. So when we're there looking at your child, you can be confident and know that, hey, when we're looking in the throat, we're looking for specific signs and symptoms. When we look in your ears, we're looking for specific signs. When we look in your nose, when we feel that belly and make your kids laugh, we're doing it for a reason. And just that you can feel very comfortable, that it may seem that we're kind of playing with your child or but we're really kind of conducting a really good comprehensive exam so that we can really know the best way to treat your child.
So I'm glad we're emphasizing that history. I think that's so critical. Just want to point out a couple of things about the history. Maybe we can expand on that lately, particularly nowadays, the importance of travel history. Where have you been in the last 30 days? There are some diagnoses that we can only make by a history. And other members of the family who've been ill, whatever illness. So I think it's really important to know what they have been and who have been exposed to, because some of the illnesses are transmitted person to person. And so knowing that, would you agree with that? And is there anything else in that category that you would expand, that would you say about the history, onset of symptom? How did it begin? Did it get worse? Is it more severe? What have you done to treat it? Is there anything else in the history that doctors are looking for when you see them in the office?
Well, I mean, yeah, I think it's a variety of things. I think the most important point is the point that Dr. Henry made, is that the more information you give us, the better. So, for instance, if you say that, my kid's been having fever, and, we ask, you say, I think it's only a day, but it's really been 5 days. That changes what we do, because, automatically as a pediatrician, fever 5 days, there's one specific diagnosis that we don't want to miss that we always think of called Kawasaki's disease. It automatically pops in our head, and we need to know that. So giving us, the most accurate information that you can is by far Absolutely. One of the best things that helps us to actually figure out what is going on.
So to our parents, important history, coming ready. I think sometimes coming in with a note about the symptoms really helpful, and sharing that with all of you. I think that's been well said.
And as Phil mentioned earlier, I absolutely love it when parents come in and they have their questions lined up. You might feel like you're being annoying. You're not. We love it. We love it when you come in and we know exactly what you want to talk about. We love that opportunity.
That's great.
So feel free to help us set that agenda, because we're here to serve you. I mean, we are here as your consultants. We're here to help you take care of your child and help you provide good care. And so use us as your resources.
Absolutely. So before we move on to another topic, just want to talk a little bit about skin infections in pediatrics. It's very common. Some of them do require antibiotics, not all of them, but some do. impetigo is one, and a few others. So let's spend a few moments talking about common skin infections. How do they occur? How are they transmitted? How do you treat them? What precautions should you take with other family members? Because they're seen, you see them. I think sometimes they create a little bit of concern to family members. So skin infection.
Yeah. So eczema is probably the most common skin rash that we see. So what is eczema? It's basically a red scaly rash. Is the easiest way to think about it. It can occur in all parts of the body. Commonly occurs in what we call the flexor area. So basically where the joints bend is the most common area. So what is it? It basically is that, just like a red scaly rash. It's not really dangerous, but very, very annoying because one, it's very hard to treat. It's a chronic issue, so it comes and goes. So, the treatment that we typically do, the first thing is just lotion. We say lather up, lotion 4 or 5 times a day.
Okay.
Really want to trap in all that moisture. Sometimes if it's moderate or severe, we will give you creams. The first cream is a hydrocortisone cream. Sometimes we give you a triamcinolone cream. So those can help to decrease it, but even after you use that kind of helps with the flares. It can help it to go away, but a lot of times it actually comes back. So a lot of that is just educating that, hey, this is more of a chronic problem. It can kind of come and go. There are triggers, honestly. There's a whole long list that we can give you. But for instance, dry skin, irritation, allergies, they're all kind of woven in together.
And then just real quick, just a message to our parents out there who are, dealing with kids with skin rashes that are chronic, that won't go away. Please, please, please do not suffer at home.
Yeah.
Do not suffer at home if your child is having this chronic, itchy, irritating skin rash. You're doing everything you can at home. It is not working. Even if you feel like you can't make a visit, please just call us.
Right.
Call us. We're happy to talk to you about it. We're happy to fit you in for a visit to see your child. Please, a lot of times we have fairly simple recommendations we can offer you, tubes, creams that we can offer you, tips, and so please do not suffer at home. Don't feel like it's not that important. Please, please, please use us.
Great. Thank you very much. Appreciate that. So, el manejo de problemas en pediatría depende mucho de la edad, ¿no? Hasta los 5 años, de 5 a 12, de 12 a 18, ¿no? ¿Qué síntomas son importantes basado en la edad? En otras palabras, ¿qué síntomas deben estar pendientes los papás de que es necesario traerlo con el pediatra para investigar de acuerdo a la edad? Yo creo que a veces los papás no saben, lo llevo al doctor, no lo llevo al doctor, el niño tiene 3 años, no estoy segura. ¿Qué síntomas son importantes que nos digan en la mente, tenemos que llevarlo con el pediatra?
So the first thing is that you mentioned it, age is super important. So especially age and fever. So let's talk about that really quick. So what does that mean? So for a neonate, a strict definition of a neonate is a baby that's 4 weeks or less. But really I always use, if baby's less than 2 months and they have a fever. And what is fever? Fever is more than 100.4 or more than 38 degrees Celsius. That's what we consider fever. If they have that, we need to see them immediately because that's actually a big deal. So if you have a 4-week-old, a 5-week-old with a fever, we actually admit them to the hospital. We need to check them for all types of infections, urine, blood. We actually do lumbar punctures. We have to draw a little bit of fluid out of their spine. So it's actually a very, very big deal. We start them always on antibiotics while we're waiting on all those cultures to come back. So age is very important. So less than 2 months, if you have a fever, you need to seek medical attention right away. If the clinic is closed, go to the ER, go somewhere, but you need to be seen right away. After that, you have a little bit of time. So after that, we always use kind of different things. But my general rule is that fever more than 2 or more days of fever, they should be seen by a doctor, right? Something's going on. It could just be a virus, probably is, but we need to make sure it's something that isn't.
Okay.
So 2 or more days of fever, we need to see you. And the third rule I usually give is that if your child just looks different, and a lot of it's kind of hard to explain. If you see them every day, but if you look at them, you're like, something doesn't look right, we need to see them right away because that intuition is usually correct, honestly. And that if you see them a little different, then something is going on, if something is different, and we need to examine them.
Excellent.
And as I said, I'm probably going to say it a million times, but if you are worried about your child, that is enough for me. That is enough for you to set up a visit. That is enough for you to call us. That worry, as Phil said, you are your child's expert. You know your child the best. And if something is worrying you, there's probably a good reason for it.
Absolutely, great.
Other worrisome signs, if your child isn't eating or drinking, so if they're having significant decreased intake of liquids, especially if they're not urinating or peeing, that's also very, very worrisome. They could be dehydrated. They could have other things going on. So that's something else that we'd also would want to see them immediately.
Great.
One other thing I would recommend is just, and this might sound fairly simple, but pooping blood. If your child is pooping blood, unless they're super constipated and have large balls of poop coming out, that could be the reason, but please don't stay at home assuming that's the reason. If your child has blood, either in the diaper or on the toilet paper, please bring them in.
And one quick thing is that, we haven't really touched on, it's not really obvious, but, mental health issues are something that pediatricians also that we deal with on a daily or weekly basis. So if you see your child also different, they seem more withdrawn, they seem that they're sleeping more, they're sleeping less, they're eating more, they're eating less, they are, they go in their room and they just shut their door and you don't see them, until the next day, that could be significant. So that's also something that we can deal with. And a lot of times we talk to the parents, we talk to the patient, the child, to figure what is going on. It could be as simple as, I got a bad grade in class today, or it could be that I actually am depressed and we really need to figure out what's going on and to treat you appropriately.
And I think that symptom or the presentation of depression in adolescence is critical. I think more and more we're putting a lot of attention to that. And I think we're here to help identify depression, look at the triggers, and begin treatment.
Yeah, no, definitely. In fact, we're so serious about wanting to identify and prevent, teenage suicides and things like that we actually start at the age of 11 with a questionnaire that all of our patients answer, trying to screen for depression. And some people might think, oh, this is a little silly. My child is 11. Of course he's not depressed. But as we know, watching the news, kids are committing suicide a lot more than before and at younger ages. And I also want parents to know a lot of times it does not mean you're a bad parent to have a child who's depressed. It doesn't mean anything of the sort. There are a lot of depression is a disease. It is a disease, and a lot of times there's no specific root cause for that. But what we can do is help treat it, So the mind is just as important as the body.
And a general rule is that kids, especially younger kids, they rarely say I'm depressed, or they really say I'm anxious or I have anxiety. They say my foot hurts or my belly hurts, or they have physical symptoms, my head hurts. So they have all of these, they have usually physical complaints for depression and anxiety. So if your child is telling you all these symptoms a lot, then that could be something. It could be significant.
And that's the importance of a good history, right? And some of the screening tests that we do in the office is to be able to detect those things, right? Great. So moving from acute care to prevention a little bit, let's talk a little bit about the kind of things that you pay attention to during a physical exam. Parents come in and bring their children to have a physical exam, right? So tell us a little bit about what that means, what you look for in the history specifically, and what things on the physical exam do require additional testing. I think we frequently see them for the so-called sports physical, but it could be any physical exam. So tell us a little bit about that, the physical exam, the importance of that in medicine, and what do we do when they detect something abnormal, whatever that is, whatever that takes you.
So a lot of our guidelines for doing the physical exam and doing your yearly checkup, or when you're a baby, your every 2-month checkup, comes from something that we call Bright Futures. And so Bright Futures is a great organization that helps set out guidelines for, what needs to be done, what recommendations are, what needs to be checked at every well-child check. And they usually follow a simple format. So we start out by asking, what are the parents concerned about? You're coming for your physical, but a lot of times parents have other concerns about their child besides their routine growth and development. So ask about what are they concerned about. We'll ask, have there been things that have happened in the child's life since the previous visit? Have they been in the hospital? Have they had surgeries, emergency room visits? Those are things that we need to know. And then we go in and ask about routine things like nutrition. How is your child eating? How is your child drinking? What kinds of foods are they? How is your child's nutrition? Along with that, how is your child getting those food out? How are you pooping? It's one of my patients said, this is what I always ask them. How are you pooping? How are you peeing? But we got to ask about it, making sure kids aren't wetting the bed when they're supposed to be past that time, different things that people don't want to talk about, we talk about.
Okay.
And then development. So when you're little, as a baby, we look at your gross motor development. How are you moving your arms, your legs, your fine motor development? How are you handling small objects, your ability to communicate, or your speech, and your interactions with other people? As you get older, developmental questions include how are you doing in school? And then social questions, how are you making friends? Are there bullies? Are you involved in activities in your school? And so those are kind of like the background. We also do social history. Who lives in the home? How are you getting along with your family members? Are you exposed to secondhand smoke? Things like that. In addition to that, after that, we might go on to safety. So, seat belts, car seats, booster seats, choking hazards, safe sleep. So there's tons of different things, drugs, alcohol, safe sex, all of that. And so there's so much that goes into your routine, and this is just the history.
Yeah.
And then of course family history. Are there medical problems that run in your family that we're going to need to start screening for at an early age? Different things like that. And then we go on to the physical.
Yeah. Exactly
She outlined it perfectly. Yeah.
So those the history of the history, and that's the physical exam. That's exactly right. So that's what we call a physical, is to identify things that would not be identified any other way other than taking the time to do it. That's the way we do it. Great. I am being told we have another 7 to 10 minutes left, so we like to move on to vaccines. Yes, Dr. Henry?
One super important thing.
Yeah.
A lot of parents think, okay, my child does not need a physical if he doesn't need any shots. That's not necessarily true. So shots are only a part of the routine preventive care. We are also there, as we to screen for things and to check for things before we develop problems. And so we're also there to help you as your child goes through those stages. We are there to help you through those stages also,
Right.
and your child. And so we're looking at growth, is your child gaining weight appropriately, and then gaining height appropriately. And then we also say when they become an adolescent, are they going into puberty appropriately? Are they going into puberty too early, too late? What's going on? And so there's so much more to the routine physical than just shots, even though shots are an integral part, and we're going to talk about that.
And if they're not progressing normally, what is the reason? Do additional testing, maybe a referral to a specialist sometimes. So that's the idea of early detection so that it can be managed well. Good point. Thank you very much. So in the moment we have left, in the minutes we have left, I should say, we're going to talk about a couple of vaccines that are really important. There's one cancer prevention vaccine called HPV, or human papillomavirus vaccine, o la vacuna del virus papilloma. We do that early in life, ages 9 through 11, up to about 26. So why don't you talk about the importance of that vaccine, the dramatic impact on people's life. We're not seeing certain kinds of cancer anymore because of that. So can you talk about the importance of that to our parents, about HPV vaccine, and then we'll go to the meningococcal vaccine.
Sure. So in general, vaccines, in my opinion, and most medical professional opinion, vaccines are the most important medical advance ever, I'll say, ever. So what does that mean? It means that there's so many diseases that, you know, even I'm only 40 years old, but when I was growing up, even something as simple as chicken pox. I mean, everyone had chicken pox, you know. I mean, everyone in the neighborhood, and I remember my mom would bring the neighborhood kids over, so we would all get infected by chicken pox, right? That was really common, right? That was everywhere. And now I have never seen a case of chicken pox ever, except when I was in my training in Chicago. So I've seen maybe 1 or 2 cases in the last 20 years. It's extremely rare.
We don't see it anymore.
But not just chicken pox, but there's all these really, really dangerous things. Meningitis is one. There's, you know, types of pneumonia. You mentioned cancer. There's all of these really, really bad things that are almost 100% preventable by vaccine. Something as simple as going to get your physical and getting vaccinated. I know I'm a parent, like I mentioned, a lot of these things are scary. You're thinking, oh my God, I'm injecting my kid. Am I injecting a virus into my kid? Am I doing this? Am I doing harm? And there's been a lot of research studies to see the benefits and the risk. In almost all cases, by far, the risks are extremely low and the benefits are extremely high, meaning that you're going to prevent your kid from potentially getting one of these serious things. One of the things that's going on, the main problems is that there's been a lot of misinformation, a lot of false information. You may remember 10 years ago, there was a big campaign that the MMR or some of our vaccines cause autism, for one. There's been a lot research after study after study after study has shown there is no link between vaccines and autism. But you still hear it, right? I could Google vaccines and autism. There's going to be 1,000 pages that come up, by somebody saying something. The problem with the internet is that anyone can say anything, right? My little son who's 7, he can go on the internet and he can write something if he wants to, and he can publish it. He knows how. But that doesn't mean that it's factual, right? So that's why I always say to please talk to your doctors and read the medical literature. A lot of my parents say, you want to read about it, that's fine. But you have to read medical literature because there's so much false information.
And I think over time what has happened, we have lost the fear of these illnesses because we don't want to see them anymore. But they're not here anymore because of the vaccines. That's exactly right. And I think HPV is one as well. So well said.
And it's interesting. I was just speaking to Dr. Williams earlier today, and I read an article, and in the U.S., measles had been eliminated for, I don't remember, like a couple decades, been eliminated. And I read an article saying that if we are continuing to get these cases of measles, they're going to remove that status for the United States, basically. Yeah. And so yeah.
And that illness, for our audience, is one of the most contagious illnesses that we have around. So it's really important.
And if you want to see, you can go right now, Google measles. You'll see the pictures. It's terrible. It is not something that you want to get. Those kids are extremely sick. It's not something that you want, especially if you can prevent it, right? As a parent, I couldn't imagine.
Yeah. And it's a clinical diagnosis. It's almost always a facial rash with cough, coryza, conjunctivitis, and typically they have these tiny white spots. It's a clinical diagnosis when we see them in the office, and then we have to create all sorts of issues to prevent exposure to others.
Yeah, so tons of runny nose, tons of red eyes, tons of coughing, just miserable child. But one thing I want to appeal is that, I think all parents love their children, and they all want the best for their children. And, if you are a parent and you're thinking, I have this fear, I don't want to vaccinate my child for these reasons, I need you to remember that there are children out there that don't have a choice. So, for instance, children under the age of 1 year who cannot yet be vaccinated to prevent measles. If they get measles from going to Disneyland, it's not their fault that they didn't receive the vaccine. Right. They weren't able to because they weren't old enough. Or those kiddos that are there with cancer, leukemia, immunosuppressed, they don't have a choice to be able to receive that vaccine. They can't. And so I want you to realize that you're not only protecting your child, but you're also protecting other people's children too.
Absolutely. It's about the health of the community. That's excellent.
And you mentioned the HPV vaccine. HPV, it's caused by a virus that actually men of the carriers, we can pass it on to women. It can cause cervical cancer. There's a couple different strains of the virus that cause it. But it's exactly that. It's preventable, Right. So my wife, every few years she goes in for a pap smear. That's one of the things that they're checking for, right? So our goal is that if everyone gets vaccinated, that we won't see cervical cancer anymore. It'll be eradicated.
We hardly see it anymore. Mm-hmm. That's excellent. So I think we have another minute and a half left. It's been a great discussion. I'm going to leave the last remaining moments for the doctors to give their final thoughts before we conclude. But before I do that, I want to thank We Love Nogales for the opportunity and all the sponsors. It's been a great conversation. I think we'll come back in a few weeks to do this again. But Dr. Williams and Dr. Henry,
just really
any
quick
final thoughts?
My final thought is nutrition is key. When you look at the prevention of disease, when you look at who lives the longest, it all is based on nutrition and exercise. So what does that mean? My new catchphrase is green is good. So if it can grow and it's green, it's probably really, really good for you. So what does that mean? Broccoli, asparagus, cauliflower, green beans, exercise, all these things are vitally important. Yes, you can come in and yes, I can help to diagnose and to treat you, but I want to prevent you from getting sick and I want to prevent you from getting a lot of things you can get just by eating healthy and exercising.
I agree with Phil. Let food be your medicine.
Great, thanks. I'm just looking at our comments. I think they're all very positive so far. For Dr. Williams and Dr. Henry, there are no specific questions, but it's been a great session so far.
And one thing I just want to encourage all of you is, never ever be afraid to just come to us with any concerns that you have. No question is too small. No question is silly. Even if you don't agree with us, please let us have a discussion. Let's chat.
Absolutely. And finally, follow a child that it was seen and getting better. Please bring him back. Our best friend sometimes is follow-up, el seguimiento, in case they don't get better. Sometimes illnesses are not diagnosed early, that's just the way they are, so we need to see them. I think with that, we'll conclude our session. Thanks for helping us, Dr. Williams and Dr. Henry, in this activity. And thanks to all the audience who took the time to be here with us, and we'll see you in a couple of weeks. Thank you, everyone. We love Nogales. Thank you very much. Good night. Bye-bye.